everyone, to another episode of Caffeinated Coverage Talk with Todd and Michelle. The holidays are here. I thought I'd wear my green for you all. My name's Michelle Berndt, and I am the president and partner of InsurTech Hub.
And I'm Todd Hall, the CEO and founder.
And you are in store. We have another treat for you guys, Mr. Leo Fernandez. He is co-founder and co-CEO of New Journey. Welcome, Leo.
Hi, Michelle. Hey, Todd.
Welcome, my friend.
Thank you,
You didn't,
sir. Thank
I should have got the memo out because you guys both wore blue and I wore green. Maybe I'm the Grinch and not in the Christmas spirit.
you. Well, the New Journey is in blue, and so that's why I wore it.
And then Todd's gonna say he wore it to support you. You guys are ganging up
Well,
on me. This is not fair.
I mean, the funny thing is at every meeting, everybody thinks I'm Todd, so there must be something
That
going on
is
there.
funny.
He's
That is
you're
funny.
he's my brother from another mother. There we
Yeah.
go. It's
Yep.
like
Yep.
twins.
I love
You know,
it.
blue is the color of trust. Yeah, I learned that
Ooh.
many years ago. So it's like, yeah, I don't know if that's correct or not. Maybe somebody can chat GPT it or whatever. But uh,
Well, we do trust you and love the work you're doing with New Journey. And I know that our
mm,
listeners are excited to hear more about your partnership with Redirect Health and just what you're all doing. But the topic is caffeinated coverage talk because we love coffee here at InsurTech Hub. So cheers, everyone, cheers.
cheers.
What kind of coffee do
Well,
you drink, Leo?
Not much, but I have to go with dairy-free milk.
Ooh.
'Cause yeah. So usually coconut milk with a little shot of coffee there, and that's pretty much it. Try to keep it simple,
Are
not
you
too
kind of
sweet.
a health freak?
I mean, I kind of have to. I was forced into it.
he's in
Well,
good shape.
yeah, that's impressive. This time of year, we have chickens and my husband makes homemade eggnog, and so that's my creamer this time of year. But he puts like nutmeg in it and cinnamon, so it's got like all flavor. So I'll have just regular coffee in the morning and then pour that eggnog on top. Woo!
Wow,
Todd, what
that
about
sounds
you?
amazing.
I'm a Dunkin' Donuts guy. I mean, I pretty much like any coffee, but if I had a go to, I like Dunkin' Donuts. And
But
Nice.
Todd, you
and,
could
and
afford Starbucks, man.
well, yeah, it's like we used to call it $5, but it's more like $8
Oh
now
my
instead of
Yeah.
gosh.
Starbucks. Yeah, it's good. I like Starbucks. I'm kind of like more of the lighter roast. So if I go to Starbucks, I'll get the blonde kind. But Leo, I only drink coffee on two occasions, and that's day and night. I know Michelle's heard that 1,000 times. So there,
We should put that. I'm going to have our marketing director create a graphic that says pop quiz. When does Todd like his coffee? And we'll see who knows the joke.
and actually, I don't drink too much coffee because I just kind of sip on it all day long. So I'm constantly going to the microwave and heating it up. But yeah, I probably drink about 4 cups a day on average. So,
I think
but
that's quite a bit, but
I read a study many years ago. It was like 20 years ago, and it was probably a study by Maxwell House or something like that. But it said if you drink 4 to 5 cups of coffee on average per day, your chances of Alzheimer's or dementia is like really low. And that was like a study 15, 20 years ago, maybe that much longer ago. So
well,
it's like,
Yeah, I
hey,
mean they do sell nootropics now with caffeine and stuff like that in it. So it's the
okay,
caffeine that gives you a mental
interesting.
boost.
could
Yeah,
be.
I
Hmm.
love it. All right, well, let's dive in because we got lots to talk about. And I think it would help our listeners, Leo, if you just tell us a brief summary of who and what New Journey is and where the concept even came.
Yeah, no, I mean, I appreciate the opportunity to speak to you and your audience. So I think tomorrow is my 20th anniversary in the business.
Wow,
So uh,
congratulations.
and I know I look every bit of it, so don't make fun of me. But
you're
yeah,
only you're
it's
only 29. Did you start when you were
yeah.
9? Yeah.
Yeah, I wish. But yeah, it's going to be 20 years in the business, and I learned a lot throughout those years. The majority of my experience has been working with individuals on high-end insurance and financial planning. I held my securities licenses for a while as well to help people through those strategies. And then and back in 2019, the perfect timing, right? I chose to re-enter the B2B world. I have experience as account executive working for telecom companies in the B2B space, and I wanted to get back in. So 2019, at the end of 2019, I started selling voluntary ancillary benefits alongside my individual business just to get my feet wet. And then we experienced COVID. So
And it
in
changed everything.
2020, yeah, it changed everything. Our businesses unfortunately shut down. The carrier I was working with shut down or didn't allow us to go out and meet people anymore, which is very difficult to have a
Wow.
B2B relationship without meeting people. So things slowed down significantly, but it gave me the opportunity to learn and to
Yeah.
pivot. So my business partner, Ray, who we are, who's not here, however, we still work together strategically in the business.
Yeah.
We kept in touch in that time frame. At that time, he was working for a carrier. We decided to join forces because we saw that there weren't any. We felt that we can do things a little bit better if we innovate and work with strategic partners like yourself. So we decided to come together 2 years ago and start New Journey. And that's
Awesome.
kind of where the name came from. It's a new journey. We wanted to be a little bit different. That's why we spelled the name wrong as well. So we dropped the Y. And if you look at our logo, we actually have that. I think it's called a macron over the E. That's what it pronounces as a long E. But with that said, what we wanted to do is we wanted to come into the space with something different, help brokers and agencies have different conversations. We wanted to have different conversations with our clients. That's why we came together and started to build it.
I love it.
Love it, love it. Leo, we're very grateful for your friendship and your partnership, my friend. And you mentioned before, like with Redirect Health, that program that you guys, that concept you put together. What are the different programs inside of that for employees to choose from?
Yeah, I mean, Redirect Health is a fantastic partner of ours. They allowed us a lot of flexibility to build the plan that we did, and we feel that we built something that uh, there isn't a plan out there that's the perfect plan, right? However, and that's why we have a lot of choices as brokers and agencies and stuff like that. However, we feel that we built our plan on a platform that uh, is a is a patient advocate first, and then a health plan second. Even though we market it as a health plan, one thing that Redirect Health does extremely well is that they fight on behalf of the members, and their goal is to reduce or eliminate wasteful medical spending, and they've been doing that for well over a decade now.
That's the key.
So
Mhm.
yep. So when it comes to these programs that are out there, you want to make sure that it's something that has stood the test of time, that is reliable, and can actually fulfill their requirements of their responsibilities, right? So we partnered with them on this platform. We do have other partners and so on and so forth that we do business with, right? Yeah. So want to make that clear that we do have other solutions, not just one, right? Because you can't just pigeonhole yourself into a situation. However, Redirect Health has been instrumental in creating what we call the debt-free health plan, right?
Mm.
And that concept was born from being able to integrate two platforms in the insurance space. That's almost impossible to do. We were able to integrate a gap carrier into the infrastructure of Redirect Health, and with that collaboration, we're able to eliminate 100% of deductibles, co-insurance, and max out-of-pocket costs for individuals and their families. So when it comes to the choices, Todd, we keep it very simple, right? A lot of times brokers come to the table when they do a quote. I've seen spreadsheets for a 10-person group with 500 plans on there. And you have this burden of HR having to sift through those plans, seeing what's the most cost effective, what they're going to be able to absorb as a cost, what they're going to pass on to the employees, what is it going to cost for them to actually access care, right? Because One of our philosophies is that it's not enough just to have an insurance policy, right? Just because a premium is affordable doesn't mean the utilization of that plan is affordable. So why have a plan that you can't use, right? So we kind of came to the table with the term that we've created something that's not only affordable to buy, but affordable to use. So our
Ooh.
plan options are very simple. Under Redirect Health, we only have 3 plans, right? They're all available nationwide. They're available in 50 states. There's absolutely no underwriting, no medical questions, and we also do not have any pre-existing exclusions.
Wow.
Now, the plan itself does have some exclusions, and we're very forthcoming on what those are. However, the majority of people um, do not experience a lot of those high dollar claims. Now, if they do, the beauty of Redirect Health, as I pointed out earlier, their patient advocacy program will find ways for people to reduce or eliminate wasteful medical spending and help them access programs that may help cover the cost or severely decrease those out-of-pocket expenses on those exclusions. But 3 plans. One is I guess you can say, a souped-up mini medical plan
Mhm.
that covers doctor's visits, urgent care, the list goes on and on, some prescriptions. Then we have 2 full medical plans that have comprehensive care, that have access to specialists, hospitalization, uh, maternity care, all that stuff is built into the plan. It is a full medical plan. It's governed by ERISA and is fully ACA compliant. So all of our plans do satisfy penalty A and penalty B. And then in addition to all of that, we made it extremely affordable. So our plans are affordable to the employer, affordable to the employee. Then when they go to use the plan, they don't go broke, hence the name Debt-Free Health Plan.
I love it. So
Mhm.
I'm hitting on like three things that I think anyone who is trying to sign up with healthcare, which is confusing to begin with and changes
Mhm.
daily, they want affordability, they want easy access, and they want a network, right? That they can that they know and feel comfortable with. It's that peace of mind, right? So tell us about your network. If you have one, are members required to use it?
That's a great question, Michelle. And one of the beauties of Redirect Health and the way they do business is that they're considered an open access plan, right? So they do have a base network because back when they started in 2013, they didn't really focus on a network because Redirect Health works with anyone, right? They're a TPA. So as long as the physician or facility is willing to take money from Redirect Health, they work with any physician or facility, right? Now, there are mechanisms for payment that they use to negotiate those terms with the physicians or facilities. However, they do have a base network, which a lot of plans very familiar with, the PHCS Multiplan
Yep, used
Practitioner
it
Network.
before.
There's over
Mhm.
700,000 providers in that network, which makes it one of the largest networks in the United States. And the fact that our plan works exactly the same in every state, in every county, in every zip code is an advantage as well. A lot of plans are sometimes are based on certain regional limited networks, and if they have employees in different states, the plan works very different. They don't have access to the same features. Our plan works the same across the United States. When a physician or facility does not fall within the PHCS network, then Redirect Health will proactively reach out to the physician or facility and create payment arrangements with that physician or facility to provide access to the member, right? So they would work
Got
with
it.
any doctor. Unfortunately, there's egos in medicine, right? So where one doctor is willing to take what Redirect Health is offering, another doctor may say, well, we deserve to get paid more, right? And then that's
Right.
where you run into the back and forth and balance billing and all that stuff. However, Redirect Health will again fight on that member's behalf to make sure that they're getting the best care possible at the lowest price.
So there is a network, but at the end of the day, the members really can choose who they want to see.
Correct.
Yes, sir. Mhm.
No, part of the enrollment process, it's really important to mention this, that part of the enrollment process, we give the members the opportunity to, we call it the hit the ground running platform. They enter all their existing doctors, they enter their prescriptions, they enter any upcoming appointments prior to activation. And Redirect Health, they'll match that up against the network. If not, they'll start proactively reaching out to those physicians and facilities.
Leo, I love how you mentioned early on when we first started, because you've been in the business now for 20 years, so you're a veteran. And I love how you guys, when you crafted this, when you went to Redirect and you put together your own proprietary group health plan with them, you put the patient first, you put the employee first, and you kind of you started there, and then you build out the plan, and always had, being their advocate, and that's what we want to be. But so I commend you for that. Kudos for that. What is like with when you're out, in the marketplace and you've got other brokers you work with across the country, and I think this plan is available in all 50 states. Correct me if I'm not, but who is your ideal employer group customer, and is there a group size that you work with, minimum, maximum? Yeah, if you can maybe talk a little bit about that.
Yeah, that's a fantastic question, Todd. We keep it simple. So our plan is unique. It's even a bit more unique than Redirect's existing platform. So if someone goes to redirecthealth.com right now and checks the plans, one, they won't see our plan because it's white labeled and exclusive to us. However, the way they segment their population normally, they have a plan from 2 to 19, and they have the second plan, which is the one we built our plan on, which is 20 plus, right? However, because of the way we structured our plan and the integration with our gap provider and so on and so forth, we're actually able to expand that to that 2 to 19 group as well, right? So we can take, we don't want to make a huge habit of the micro groups per se, because sometimes those smaller groups, if they come with health issues, and we could have a couple problems there, but we take any size group between 2 and up, right? I think the sweet spot is probably under 100 lives. That's kind of the sweet spot from that 2 to 99 space, 2 to 100. But we have worked with much larger groups with Redirect Health. Redirect Health does have much larger populations. We just have to be more strategic in that larger group space. And then we also have other partners as well that can fulfill that need too.
Yeah, that's really good. A lot of employers don't even look at stuff like this because they're like, I'm not going to pay any portion of their insurance. I can't afford it, or that's just not something we're going to do. But what I think is important for them to understand is at least you're providing an added value for your employees. You don't necessarily have to pay some of their premium or whatnot. You're at least giving them an added value by these are the choices for affordable healthcare and comprehensive healthcare that we can provide for you. So if you are an employer listening in, I encourage you to think of it that way. Let's talk about the member experience, because at the end of the day, everything goes down to what does the member experience? So tell us, Leo, is it easy to enroll? And once they enroll, are they thrown to the wolves, or what does that experience look like afterwards in navigating the system?
Yeah, we believe that we built a very end-to-end platform, so to speak, right? So when it comes to enrollment is one of the easiest plans to enroll. For the broker, right? All they have to do, they go on our website. We have a special website just for New Journē. All the brokers that we have contracted are inside of that portal, right? They go online, they do a 2-minute application with the employer, basic information. They collect basic business information, tax ID, so on and so forth. That kicks off implementation. The employer then receives an implementation packet, which is very simple, ACH form, so on and so forth. The broker is responsible for collecting the census information. They provide the census and the implementation packet back to Redirect Health. Redirect Health then builds the case on Employee Navigator, which a lot of brokers already use. They send out enrollment text messages and emails. The employee picks their plan. They'll only see what their financial responsibility is after the employer contributes. They pick the plan, they enroll, they download the app, enrollment is done, right? We could stand up a group in a matter of a few days if needed. Then afterwards, after the member enrolls, when they activate their service, they go through the hit the ground running platform. They activate their plan. They have at that time they have the opportunity to disclose their doctors, prescriptions, so on and so forth. Then our membership team has that information. When the account activates on the first of the following month after enrollment, the employee uses the app to contact Redirect Health. If for some reason they don't want to use the app, there's an 800 number. You could also text Redirect Health.
Wow.
So we give people all the opportunities to be able to contact and get care. And as long as the employee is going through that process and contacting Redirect Health first and allowing them to act on their behalf, we like to call it a medical concierge service, right? They'll
White
do
glove.
everything for the member, yep, on their behalf, and they'll negotiate pricing. They'll negotiate. They'll work with their physician and facility on their and the facility on their care plans. It's a peer-to-peer authorization process, which means it's doctor to doctor. It's not 800 number, $20 an hour employee going through a computer telling a doctor what they can and cannot do.
Wait an
It's always
hour to
peer-to-peer.
speak.
Yeah. So all that stuff is handled by Redirect Health. And as long as they're doing that, the majority of out-of-pocket expenses are waived. So we're talking about doctors' copays, urgent care, x-rays. Those are all covered at no cost. And then we have the deductibles and co-insurance covered by our gap plan, right? So I'll give you an example. Just a couple of weeks ago, one of our members, and he happened to be the decision maker at a group, he had both United Healthcare and our plan, right? So a lot of people do that. They carry two insurance products. Well, his surgery was declined by United Healthcare. We stepped in at the last minute, coordinated the care, and we covered his $3,800 out-of-pocket expense.
Mm.
Mm-hmm.
And he got to go to the hospital he wanted to.
Leo, you mentioned with covering, not having a deductible or having those co-insurance expenses in America, bankruptcy is the number one cause is medical debt. Yeah, I mean, I don't know what the statistic is, but it's like 50-60% of all bankruptcies are due to people carrying medical debt. And in your plan, you won't have that as a debt-free medical plan. It's like, yeah, so that's pretty kudos to you. I did see on your website when you're talking about your app, and that has access to care 24/7. Can you tell us a little bit about that? How would you navigate that? Is it included with the membership with the plan?
It is. Everything that we speak about on the plan is included in the plan in the same premium, right? So our standard hospital plan is $511 for 2026. That's the all-in cost. That includes the medical plan. That includes the gap is already embedded in that, right? So that's a huge savings when we compare that to other plans. The telehealth, however, I do want to make a point about that. It's very different than traditional telehealth options that are out there. I mean, you can go to Amazon right now. You can buy your TV, and then you can see somebody via telehealth for like $10 on Amazon right now. However, those services are very impersonal, right? They don't have any of your data. They're basically interviewing you. They're 1099 employees, right? Or 1099 contractors. And the goal of a 1099, as you already know, especially in the medical world as well, you have to see as many patients as possible in a day, right? So you don't get that personal experience. Even right now, you go to your primary care physician, the average time you're actually seeing your doctor is about 5 to 10 minutes, right? But you're in the waiting room for 30, right? So anyway, their telehealth is 24/7, 365. So Christmas Eve, New Year's Eve, Christmas Day, New Year's Day, they are there. They're on staff. And Redirect Health is very different because they're also medically licensed in all 50 states. It's very difficult to get a medical license in one state. They have on staff, they have physicians and practitioners medically licensed in all 50 states.
Wow.
Why is that different? because they have access to electronic medical records, your prescriptions, they have your medical history, so they can provide true medical care immediately, right? As soon as you, and it's the biggest button on the app. So to answer your other question, on the app, it's the biggest button. It says 24/7 virtual care, and it's true virtual primary care because of
And the
that.
app's free to use. I mean, this is great
App is free
stuff.
to use.
Yeah. As a mother of two kids, being able to, in the middle of the night, call in, speak to an actual doctor, and by breakfast have, if applicable, the medication called into the nearest pharmacy, game changer. I love that.
Yep. And they'll file the prescriptions. You can pick it up within minutes or hours, whatever the case may be, and everything. Now, Michelle and Todd, I haven't told you this yet, but I can get you access to the Redirect Health app for free. You could even use the telehealth portion of it for free. You won't have access to all the other comprehensive features, but any broker that has the opportunity to bring a case to the table will be able to get them access to the Redirect Health app.
Count me in.
I love that.
I
Me
got a
too.
kid in college. I need something like this. Absolutely. So, for our employers listening, as we kind of start to wrap up, because we've mentioned so many amazing things about this program, what would be like the top 3 reasons an employer should consider looking at New Journey?
Well, I mean, one is simplicity. We're not going to inundate you with all these options that you have to hire a part-time person to kind of sift through.
Yeah.
So simplicity is one of them. Because as a business owner, your time is extremely valuable, right?
Time
So
is
we want to
money.
eliminate exactly. Then affordability, right? If you want to provide a benefit to your employees, that's one, affordable to you as the employer to invest in because it is an investment, and two, have a price as well that the employee can feel comfortable participating
Yes.
in. Those are 2 things. And then the third thing is that when they go to use the plan, your employees don't go broke, right? Because as Todd mentioned, that debt is a stressor, and additional stress adds additional disease, right? So a lot of times people avoid medical care because they can't afford the MRI or CT scan. Their cell phone bill is more important than the medical bill, right? So they do 2 things. They avoid medical care altogether, and then in 2 or 3 years, they have stage 4 instead of catching it in precancerous or stage 1 or whatever the case may be. Or 2, they get the medical care that they need and they swipe a credit card or get a line of credit, right? So being able to eliminate that stressor for your employees is important. And then the third thing is basically the service that we provide. Every employee gets a dedicated account manager within Redirect Health. They also have access to me and my team when things arise. So we cover everything from end to end. We want to make it simple. We want to make it affordable. And we also want to make the process afterwards as seamless as possible. Now, I do want to add a fourth thing there, which is an ROI component. Because
Pretty important.
a lot of employers fail to realize that a lot of their turnover and a lot of their absenteeism is based on the fact that they're not offering a comprehensive benefit like the one we provide. So we actually do those calculations if people want to see what the unseen losses are in the business for having high turnover. We met with a business last week that had 50% turnover.
Wow.
No medical plan, right? So we showed them how much money they're losing. And of that 50% turnover, that was costing them approximately $850,000 a year.
Wow.
So would you rather invest $100,000 a year in a medical plan or lose $800,000 a year? If we can help you with that, that aspect of it,
no
it'll be
brainer.
worth it.
Yeah.
So
it's funny you added
those
number 4 because I was going to add number 4 and say reputation. I mean, Redirect Health is very reputable, and so are you, Leo. I mean, Todd and I trust you. We love our partnership with you. So, reputation's key too. You can't join something that you've never heard of or is backed by something good. Yeah.
Yeah, my grandma used to say many years ago, an ounce of prevention is worth a pound of cure. And it's just, I mean, I know you've heard it a million times before, but it's so true. And yes, group health is by far, Leo, the number one requested employee benefit, what employees want. And I'm surprised how many small businesses don't offer group health. And for whatever reason, they think number one, they can't afford it, or number two, they're too small. But with your plan, they can do both. They can afford this plan to offer it, and they're not too small because you can do, you can service that small market business. But it's hard to believe, guys, that we're less than 1 month away from 2026. I mean, it's nuts. Yeah, it's like 3.5 weeks away. So as we have Leo and coming 2026 coming up, what enhancements would you like to share with our listeners that you've got with New Journey, with Redirect Health, with your plan? Load us up. Yeah. So whatever you got coming.
I mean, the first thing is that our 2026 rates are already established, and Redirect Health had, even though a lot of other health plans right now are jacking up their rates by 10-15% or more, we actually had a broker come to us. One of his groups had 155% increase on their health plan, and they had no justification for it. They said there's future potential claims, and there's no. So anyway, the environment out there is tough. Redirect Health, even in this environment, only raised their rates 4.5%.
Well done.
Wow.
So that 511 includes our 4.5% increase, and they've done that consistently for over a decade, right? So that's one thing I wanted to, give good news for 2026 because we only had a small increase. But we are working on some new enhancements and products. We're creating other little niche type of plans within Redirect Health, but then we also have other partners that are allowing us to create debt-free style health plans on a different chassis in case for some reason Redirect Health is not a good fit for them. So we're working with other partners in that sense. And we're also launching, we're in the process of launching a group Medicare plan. When paired with Redirect. Now you wouldn't believe how many people are still working because of the economy over 65, right? So we have something now that we can actually provide those members in those groups. And when paired with Redirect Health, we actually have a powerful group Medicare option as well.
That's very interesting, Leo. So you could have a traditional group medical plan, and in addition to that, a group Medicare plan in the same employer group. That's very interesting because a lot of times, and that's fantastic because sometimes as we get older, and I'm part of that group too, things don't work as well, and you kind of get a little, it's like, so you tend to have more claims than you are when you're younger. So a lot of times, if you got people that are 65 and older, if they have a group Medicare plan, they can take those claims off of the traditional plan to help that. That's a fantastic enhancement. Wow. I didn't even.
And with our partner, if a group takes on the Redirect Health plan, because of that, the way the plan is structured, under the group Medicare option, an employer can make a contribution into the group Medicare plan. And we have it built so essentially, depending on the contribution level that the employer is contributing into the employee's plan on Redirect Health, we can get a Medicare recipient to have zero out-of-pocket expenses when it's all said and done if they chose to do things a certain way with the employer's contribution. So we're excited about that, about that partnership as well. We'll love to have a conversation with you at some point about that. But that's one enhancement that's coming for 2026 as well.
Yeah, congratulations, my friend. So if people are like, okay, you got my attention, what is your website so they can find out more?
Yep, they can either go to newjourney.com without the Y, that's important, or New Journey Consulting, it'll forward it to newjourneyconsulting.com. If they want to see the Redirect Health plan, it's redirecthealth.com/new-journey without the Y.
Okay.
And that'll take them to our landing page where they see our plan and our rates. And then that's where the broker would actually go to submit a case as well.
Perfect. And
once they're contracted.
Speaking of brokers, so Todd and I have worked with Leo for quite some time now. And if you feel this is something you want to add to your product portfolio in 2026, please reach out to Todd or myself, and we can get you contracted directly with Leo. And yes, you can make a lot of money while helping a lot of people, and that's what it's all about. So, Leo, thank you for being on our show.
Thank you for having me.
Thank you, brother. Appreciate it. Thank you so much.
Yes.
Thank you,
And
Todd.
tune in next week for another episode and another great guest. And cheers, my friends. It's been
Cheers.
great
All right.
having you on Caffeinated Coverage Talk. Bye, everyone.
Bye bye.